Try that again with the microphone on. Good afternoon, everybody. Thanks for joining us this afternoon. We got several things to chat with you about today. And then, of course, we're going to take your questions. Up top, we'll start with COVID numbers. We'll talk a little bit about vaccinations. We'll talk briefly about the American Rescue Plan, which was just passed within the last hour or two by Congress and is headed to the President's desk. And we'll take your questions. So, more good news, still good news, I should say, with regard to the COVID numbers. The city of St. Louis yesterday reported 25 new cases. It was up from the day before, which was 14, 19, 24, 25, 27, going backwards. Our average number of new cases per day is 22, rounded up to a whole person. 22, and if you, that's 7.1, let's call it 7 cases per 100,000. The state's at 8.5 cases per 100,000. St. Louis County's at almost 15 cases per 100,000. St. Charles is at 7 cases. Jefferson's at 17. So, bottom line here, City of St. Louis continues to do well in keeping our case count down. That's a credit to all of the folks in the City of St. Louis who are wearing their masks, social distancing, washing your hands. It's a credit to our businesses who are following the protocols, the mitigation procedures that we've asked them to follow. And that's the reason I think that our case count is as good as it is. Still, 22 people a day are being diagnosed with COVID. In terms of number of people who are in the hospital, these numbers also continue to get better. Yes, these numbers lag 2 days. I think you know that. 251 people were in the hospital 2 days ago. And that compares with, let's look back here to March. 2 months ago, there were 800 people in the hospital. So today, 251. Of that 251, 65 people are in the ICU, and 39 of them are on ventilators. So still a number of people that are really pretty ill in the region with COVID. Average number of people being admitted to the hospital per day, and this is a 7-day average, is 32 people. So all of those COVID numbers are good, much better than they have been in months since about October, November timeframe when the numbers really started going up. So we're pleased about that. The 14-day positivity rate in the city is 3.5%. That means 3.5% of the people who take the COVID test in the city are coming back positive. So, of course, that's also a very good number. Let's see. I think those are the pertinent numbers for today. The vaccinations, we talk about vaccinations every day. This week, the city of St. Louis received yesterday, I believe, we were supposed to receive yesterday, right at 2,000 doses, half Moderna, half Pfizer. We have not gotten any Johnson & Johnson vaccine in the city yet. We do expect some to be coming our way. We have another mass vaccination event this weekend on Saturday at Carpenter's Hall. We expect to do 1,500, maybe more, vaccinations on Saturday. We, of course, are going to be working off of our list for those people that have registered and who want the vaccine. I do have to remind you, this is appointment only, invitation only, like all the mass vaccination events. So please, if you made an appointment, please keep your appointment. We have had some people not showing up for their appointments, and that, of course, is a struggle because we're holding a place for you. If you got in somewhere else, you got in earlier, or you got a better appointment, or whatever it might be, please cancel if you're not going to keep your appointment, so that we can put somebody else in that slot. We are still focusing on those over 65, and this is Phase 1B, Tier 2. People over 65, people under 65 with underlying health conditions, and of course, healthcare workers, first responders, as well. So we're working off our list. If you got an invitation from us, invitations, I believe, started going out yesterday. If you got an invitation because you are on our sign-up list, please respond as soon as you are able. Get your appointment. Go for an afternoon appointment maybe. Often people are signing up for first thing in the morning, and anybody who's been to one of our 13, I think it is, mass vaccination events, you know that the morning is kind of crazy. It's very busy in the mornings. In the afternoon, it dwindles off a little bit, little less of a wait in the afternoon. So we're doing that at Carpenter's Hall again. Invitation, get your appointment, show up just to, if you've got an appointment for 11 o'clock in the morning, you can show up between 11 and 12. Don't come too early, come 10 minutes before your appointment, something like that, because we're still working through the people who had 10 o'clock appointments. So anyway, we're really pleased to be able to do that and continue to offer the vaccine to folks. Focusing on over 65 or those with underlying health conditions. What was I going to say? Oh, in the city of St. Louis, the Deloitte report, which the state commissioned, estimated that we have right at 115,000 people that are in Phase 1B Tier 2 or above that are eligible to get the vaccine. So that's a little over a third of the people in the city of St. Louis. Now, so far, we have vaccinated 33,000 of those people. Sorry, I'm looking for the number, I lost that. But I'm pretty sure it's right at 33,000 people. Is that right? Mm-hmm. I can't read that, I don't have my glasses on. It's right at 33,000 people.
33,000 first doses, 53,000 total doses.
Right, so, most people, well, everyone so far has been getting 2 doses. Excuse me. So 33,000 people either have both doses already or they're lined up to get their second dose. On Saturday will be primarily first doses. And so those will be new people coming in to the mix. We are getting more vaccine. We can always use more. And we also, as you know, there are about 8 pharmacies in the St. Louis city that are giving vaccinations. A couple of them don't have vaccine at this point in time, but you might go on something called Vaccine Finder, which we can post a link to that. I was looking at that this morning. There are a lot of places that are giving vaccinations, but they don't have vaccine right now. I mean, they run it as soon as they get it. They get the shots in arms, and then they have to wait for the next shipment. So, but if you are over 65, please get signed up and get an appointment to get your vaccination. What else here? I think that I mentioned at the top here that the American Recovery Program, American Rescue Plan was just passed a couple of hours ago. That's very significant assets, very significant help for people. It's 85% of the households in America will get a direct check of $1,400 per person. So if there's 2 in the household, and that 85% is folks who make $75,000 or less if it's an individual, $150,000 if it's a couple, plus $1,400 for each child. So if you're looking at a family of 4 making under 150,000, I believe is the amount, you're looking at a $5,600 check that'll be coming your way very soon. So that's good news. In addition to that, the federal unemployment benefit has been extended until September. That's $300 additional per week. Children, families with children will get $300 per month per child for the next year. That's a significant help for many low-income families that are in poverty, to help raise those kids and those families up out of poverty a bit. Child tax credit has been increased and will really benefit many, many people. So we are excited about that. In addition to that, the city of St. Louis will be receiving a very significant amount of funding to replace lost revenue that we've had because of the COVID virus, and also to do a number of other things. And so we're going to talk more about that probably Friday or Monday, but a very significant amount of money which the city of St. Louis should be able to deploy to help its people even more. And lastly, and I'll repeat this for those of you that were not on Monday, we did increase the closing time for bars and restaurants from 11 p.m. to 12 p.m. Now, as I mentioned, I guess it's 12 a.m., 11 p.m. till midnight, let's say midnight. As I mentioned, all of these numbers look good. Our case counts look good. The number of people in the hospital looks good. Hospital admissions are down. Our positivity rate is down. So we are looking at all of the mitigation strategies and expect to make some additional changes in the next week or two. And that's really to help more people get back to work. Now, we're not going to stop wearing masks, and we're not going to stop social distancing, but we may be able to lift some of the other restrictions, and we're looking at that as we speak. You know, we are, like Dr. Fauci says, and like most of the national news on this, we are very excited about these low numbers that we have, but we are also cautious because we know that the variant, particularly I think it's called the B117 variant, which is from the United Kingdom, is present here. It's highly contagious, and so we are just going a little cautiously here in terms of lifting restrictions. And I bet there are some questions.
A few questions. So Aaron's question to start off today, Mayor, what kind of progress is the city making in terms of percentage of residents who are being willing to accept the vaccine whenever it's offered to them?
Well, as I mentioned, we've had 33,000 people in the city of St. Louis, so a little over 10% that have already gotten the vaccination, at least one of them. There are many other people that I run into who want the vaccination, but who are not necessarily over 65 and may not have underlying health conditions. So I think it's hard to say, well, exactly how many people want the vaccination. If we do a little back of the envelope arithmetic here, there are 300,000 people in the city of St. Louis, 60,000 of them are kids under 18. So 240,000 adults. You know, if half of them want it, that's 120,000 people. We vaccinated 33,000 so far. We are making progress there. We know that among the first responder workforce, we are at over 50%. We're at 55 to 60% of our own workforce. Whether or not that number will hold up for others, it's hard to predict that at this point in time. But what we do see happening is that a month ago, there were fewer people saying, yes, I want the vaccination. Now they've seen a lot of people get it. 33,000 people in the city of St. Louis have received it. And so they're perhaps becoming more open to it. We really do need for as many people as possible to get the vaccine. And of course, we need the vaccine to be able to give it to you. But there are a lot of places to get it now. BJC, SSM, St. Luke's, Mercy Hospital all have lists going and are all giving, they are giving the most vaccinations. They get the most vaccine and they're giving the most vaccinations. In addition to that, our federally qualified health centers are actively seeking out people over 65 or those with underlying health conditions to get into their places and get the vaccination. There's some reluctance among some folks, older folks, and sometimes older folks do not have the same access to technology. A lot of this, as you know, is online registration. If you know someone who wants to get the vaccination, but who doesn't have the ability or access in order to register themselves online, call our health department, 657-1499. 657-1499. If you're a neighbor, help that older person call and get themselves on the list. Or if you have access to a computer and you can register them, do that. I've been at all 13 of these mass vaccination events that we've done, and Saturday, I believe, is going to be our 14th. And there's always, last Saturday, this is kind of heartwarming, there was a gentleman came in. He was registered. He had an appointment. He was 98 years old. He had his 3 kids with him. Well, his kids were all over 65. They also had appointments. So all 4 of them got their first shot last weekend, 98 years old. We had another gentleman who, I think this was a woman. The second one, I think, was a woman, also 98 years old. So if you have a neighbor or someone who needs some help with that, give them a hand. 657-1499, and we'll try to get them in.
Speaking of seniors who don't maybe have access to technology, Sarah's question has to do with any efforts the city's undertaking to reach homebound, elderly, and people who can't leave the house.
Yes, of course. So we've done several things there. One, we have gone to the St. Louis Housing Authority, and they have this Sunday will be their second dose, and we vaccinated older people who live in St. Louis Housing Authority properties. We've also talked with, and when I say talked with, all of the folks who get Meals on Wheels have gotten a flyer, and the person that delivers their meals has talked with them about, do you want to sign up for the vaccine? And we have, of course, we know where those folks are. Some of them are homebound, but some of them just have difficulty with transportation or difficulty getting around. We have used senior center buses to bring them to vaccination sites. Those people that are truly homebound, who cannot leave their house, we are expecting to give them Johnson & Johnson vaccine once we get it, because that is a one-shot vaccine. We're doing a lot of things. We've gone to any number of senior centers who have organized transportation and also organized vaccination events at their center. So there's a lot of outreach to people. No doubt we're probably still needing to get to some people, but we're using senior centers, senior housing, housing authority. Our own Department of Senior Services has a list of seniors who they check up on, and this has been evolved for years, that they check up on when it's real hot or when it's real cold or when there's some situation where they feel they need to be checked up on. So we're using all of those methods to get to seniors.
Lindsay's question has to do with mass vaccination events coming to the city that maybe the state is sponsoring. Has there been any movement on getting something like that in the city of St. Louis?
There have been a couple of state-sponsored events. One was at Harris Stowe a week ago. I think it was a week ago tomorrow. Last week, one day, there was a state-sponsored mass vaccination event at Harris Stowe. The state has also gone to some senior centers, senior housing projects. There is not one on the books right now that is a state-sponsored event that I'm aware of.
Mayor, earlier you mentioned about revisiting some of the restrictions. We've had folks ask if that applies to maybe higher gym capacity, folks asking if they'll stop requiring bi-weekly testing for student athletes, if all of that is in the conversation.
Well, that's two things, right? Both having to do with sports, I guess, gyms and youth sports. We will look at those items. What we're looking at right now primarily is bars, restaurants, large venues who put together plans and submit them for us. But of course, everything is on the table.
Stacia's question has to do with the numbers falling, the COVID numbers.
Mhm.
Are more people getting vaccinated, or is it because there's not enough testing happening?
No, Stacy, more people are getting vaccinated, and it has to do with it's called the R naught factor. As you get fewer cases, and as the R naught is below 1, meaning one person affects one more person. If one person is only affecting 3/4 of a person, that's when the R naught is down, and that's when the number of cases are going down. There are still a lot of people being tested. Anyone who goes in the hospital is tested. And if it were simply fewer people being tested, then our positivity rate would not be so low, because the people getting tested will be people who aren't feeling well, who say, well, maybe I should get tested, or people going into the hospital. And if that were the case, then we wouldn't have a 3.5% positivity rate.
We did get a question from Brad, who's watching, and asks if the city takes into consideration the location for its events, based on whether or not it's on a public transit line or close to Metro Transit, because many people don't have cars.
Absolutely, we do. Our mass vaccination events have been at Union Station. They have been at the Omega Center, which is Goodfellow and Natural Bridge, and they've been at Carpenter's Hall, which is a 1401 Southampton. All of the events that we have done have been on public transportation.
That is all I have for questions today, Mayor.
Okay, good. Thank you all. Appreciate you being with us. Talk with you again in a couple of days. Thanks. Bye-bye.